Okay. Thank you so much. So I have here the presentation. This is a real masterclass of practice growth in patient management and a high performance practice. I met Dr. Achnaf Al-Jaja, who is a very, very known and very knowledgeable CEO of multiple companies. And he has been an inspiration of all these books. Okay. Endless hours talking to him, endless hours when we were in Bahrain, when we were in Saudi Arabia. First time I met him was in 2005, by the way, in Saudi Arabia, in Dammam. And well, this masterclass here, and I will start right away. We will talk about the foundation, okay? Then case presentation and the psychology of yes, so that the patient says yes, okay? Then the closing sequence. So how do you close a patient? Then high performance operations and internal marketing. Then your personal branding and leadership. Then the four skills of the modern dentist. And then I make a small summary and a conclusion of everything we have seen. And everything we have seen is a little bit, a small taste of all these courses and books that I have written. Okay, the foundation. Let's go. And good. We are taught how to prepare margins and place implants in dental school. But we are never taught how to actually communicate the value of those treatments to a patient. Today, we bridge the gap between clinical excellence and high performance practice growth. Okay? And I thought everything that I teach is only for dentists that have their own clinic, not for dentists who are working in a clinic that's not theirs. But no, I was mistaken. A good friend and former student of mine of Kuwait, he told me, I am working in a clinic with 40 other dentists, mega clinic. But when one of my relatives, my cousin, my brother, my sister, calls the office and asks for me, he gets an appointment with me. So I thought, why don't I make people just call the office asking for me that are not my relatives? So I can make more of good dentistry. And this is called personal branding. He branded himself. He actually actively worked all the concept that I'm teaching for him, although he was not a practice owner. Okay? So we are in the retail service profession. Unless a patient is in acute throbbing pain, everything we do is elective. So crowns, veneers, implants, patients choose to buy them. Therefore, we are in the retail service profession. It is our ethical duty to learn the psychology of how to guide patients toward the best medical choices. Marketing and sales. Marketing makes the phone ring. Sales happens face to face. Dentists constantly confuse marketing and sales. Well, marketing is your website, your social media, your branding, your business card, okay? Your elevator pitch. Its only job is to get the patient to call or walk in. Then sales is everything what happens next. Your front desk etiquette, your lobby design, your case presentation, that is sales. If your sales system is broken all your marketing money is wasted. So make them aware, make them call, make them show up, and make them accept the treatment. This is your sales funnel. If your front desk is rude, the funnel breaks at the call. So nobody knows you. So your marketing makes that somebody knows you and that they call the office. Then they call the office. If your front desk is rude, the funnel breaks at the call. So they don't come, they don't make an appointment. If your presentation is confusing when they sit in the chair, okay, the funnel breaks at the acceptance, okay? We must block the leaks in the funnel. We must find out, okay, how many people call the office? How many of them made an appointment? How many of them really came? And how many of them accepted the treatment? By knowing that, we know where we have to improve. The ideal thing is 100 people call the office, 100 of them come, 100 of them sit in the chair, make an appointment, sit in the chair, and 100 of them accept the treatment. This is the ideal thing, which that never happens in real life, okay? Never, okay? But we can go as near as possible to these figures. How? By improving all these steps. Features versus benefits. Stop selling titanium. Start selling self-esteem. A feature is the brand of the implant or the percentage of the whitening gel. Patients do not care. They buy the benefit. They buy the ability to bite an apple, the confidence to smile at a wedding, or a way out of pain. Sell the benefit, not the feature. So concentrate on the benefit. Don't concentrate on, okay, we will make a bridge to implant here, the bridge there. No. Benefit. Benefit is how you bite an apple, how to have a confidence, how to build up your smile again, okay? How this lip that is inside comes out again, okay? These things. And don't be cheap. In a hostile market, the temptation is to lower your prices, of course, but do not do it. Competing on price is a race to the bottom. So you compete on price, you might price lower, 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 and at the end you end up at the bottom. When you are cheap, you attract patients who only care about price, and they will leave for someone 10 euros cheaper. We must compete on value and experience, not cost. So what's the true value of a new patient? Stop looking at the single transaction. Understand the lifetime value of a patient. A patient is not worth the 50 euros they spend on a cleaning today. If they stay for 10 years and refer the family, that single patient is worth tens of thousands of euros. Treat every new patient like a massive long-term investment. So the first impression is the telephone. And there we have to apply the 82% rule. What's that? The patient experience begins before they even see you. It begins on the phone. In telephone communication, 82% of the message is conveyed through the tone of voice and only 18% through the actual words. If your scheduling coordinator, front desk, sounds stressed or bored, trust is instantly destroyed. The protocol of price quotes. So never give a final binding price over the phone. Give a range and then use this exact protocol. Because every mouth is different, Dr. Gomez cannot give you an exact price over the phone. We need you to come in, meet the doctor, and get a proper diagnosis. Then you will leave with an exact written treatment plan. And then immediately pivot to scheduling. That means make an appointment for that patient. Okay. So that is what the front desk has to say if they ask for a price. The on stage mentality, the Disney philosophy. Disney has when people change to be Goofy or Mickey Mouse or something like that, and then they go out of that house where they change. Okay, the door that they open to get out, that door has a sign, and the sign says you are now on stage. So why you are now Mickey? You're not Mr. Smith anymore. You're now Mickey. Once the patient schedules, your office must adopt the on-stage mentality, much like Disney. From the moment the patient walks through your door, your entire team is on stage. No complaining about personal issues at the front desk. Total professionalism is required to build the trust. Okay? Now, the Ritz-Carlton experience. I'm a big fan. I'm a big fan of the Ritz-Carlton hotels. It is a lobby, not a waiting room. You have a lobby in your clinic, not a waiting room. We must deliver the Ritz-Carlton experience in your office. Start by changing your vocabulary. It is not a waiting room. Waiting implies a waste of time. If I wait, I waste time. What is positive on the word waiting room? Nothing. It is a lobby or a reception area. So we never talk about a waiting room. It must be immaculate, smell good, look like a premium environment. Okay. We have written in our entrance in German, a sentence in German because I was born and I grew up in Germany and I've studied in Germany. First, I studied dentistry. Then I made my PhD in implantology. And then I studied medicine. So I'm a physician too. And in Germany, there is a saying from Gottlieb Daimler. Gottlieb Daimler is the founder of Mercedes-Benz. Okay. And he says, das Beste oder nichts. That means the best or nothing. And this is what we show to our patients in the lobby. Well, the first 7 seconds are decisive. Trust, likability, competence. The patient decides in the first 7 seconds. When you, the doctor, finally walk into the consultation room, the first 7 seconds dictate the success of the case. So if you come in stressed and you're thinking about the root canal you had to do on this patient that has the root like this, okay, man, you put that stress on the next patient. In those 7 seconds, the patient decides if they like you and trust you. Stand tall, make eye contact, smile, and greet them warmly. Leave all your problems out. Non-verbal communication. 93% of your message is unspoken. Why are those first 7 seconds so crucial? Because communication is 55% body language and 38% tone of voice. Only 7% consists of the words you actually use. Your posture and empathy speak infinitely louder than your clinical terminology. You have to transform your clinical vocabulary. Say invest instead of cost. To build high performance, you must transform your vocabulary. Never use the words, for example, cost or pay. Say invest. Patients pay for a parking ticket, but they invest in their health. Do not ask them to sign a contract. Ask them to approve the paperwork. Semantic shifts drastically reduce the patient anxiety. And active listening. The golden rule is, the rule is 80-20 rule of listening. What's that? Well, dentists talk too much. The more the dentist talks, the lower the case acceptance. You must practice active listening. You should only be doing 20% of the talking. Let the patient do 80% of the talking. Listen to understand, not to reply. Sometimes dentists just stay there and then listen and they wait for a question that they want to answer. No. You have to listen to understand what the patient really needs, what's important for the patient. Ask the questions to understand and listen. And show that you listen. Restate and clarify. Listen is an active process. Periodically restate what they say. To be sure I understand, it sounds like you are saying your main concern is the dark color of your front tooth. Is that true? This proves you are listening, and it builds immense trust. And trust is everything. He who asks the questions controls the conversation. Questions hook the mind. You are in control of a consultation only if you are the one asking the questions. Questions help you discover the true needs and emotional pain points of the patient, gathering the exact information you will use later to present your solution. You need to understand what's his pain point. So what's the problem? What's his biggest problem? Maybe you see other problems, but for him, that's not a problem. For him, something else is a problem. You must understand what's the problem for him. And if you understand what's the problem for him, then, and you give him a solution for that problem, you are the one chosen. Try to make him pre-own the treatment. Paint the picture of success. Make the patient pre-own the treatment before they buy it. Ask them, for example, okay, what is the first thing you're going to eat when we fix this denture? Or imagine how your smile will look in those wedding photos. Get them to mentally and emotionally own the result. If they own the result, they want the treatment to get that result. A BMW car sales rep, he's not selling you the four wheels, and all these features. He's selling you, putting you in a dream, driving the Toscana in Italy, the wind blows on your hair, you see the seaside, you see the mountains, you see all the trees, and you feel the curves when you drive them. This is what he's selling, not the car. Is that clear? So we have to do the same thing. So why patients say no? Well, basically because of four reasons: no trust, no need, no money, no urgency. So before we move to the case presentation, we must know why patients reject treatment. It boils down to four reasons: they don't trust you, they don't understand the need, they lack the money, or there is no urgency. Your presentation must proactively destroy all four of these barriers. So they have to trust you. So build up trust, like explaining. While you explain the solution, you explain how many cases you've done, how many years you know that, how many courses you've done, something like that, Then trust. Then they don't understand the need. You have to make them understand that need, because you have them to make it that they see what happens if we don't do what you're proposing, okay? Then the lack of money, you address it. I will talk about that a little bit later. And then the urgency. Urgency you can build in by scheduling problems. Like, we have to. If you think too much, for example, okay, but in other words, then our schedule is really busy. My schedule is really busy, and I have opened some dates for next week. That's putting him into an urgency for next week, okay? And so we could schedule you in there, for example, okay? Good. So why patients say yes? Well, they say yes when they like you, when they want a way out of the pain, or when they relieve the story. Conversely, why do they say yes? Well, first, they must like and trust you. Second, they see your treatment as a way out of the physical or emotional pain. I don't, I don't like my smile. I never smile because there's one tooth missing, or I never smile because they're all over the place, my teeth. Okay, well, I never smile because my lip just lifts up too much. Whatever. Okay. And third, they believe the story. The story is your passion, your expertise, and the narrative of how this will change their life. And why you? Why you? The transition to case presentation. Okay. Well, let me just take this here and put that from connection to conversion. We have now established the foundation, okay? We have created a risk culture environment, trained the front desk, built trust in the first 7 seconds, and uncovered the emotional pain through active listening. Now, it's time to present the clinical case and close the treatment. Case presentation and psychology of yes. So first of all, the presentation environment is important. Never present in a vulnerable position. Never present a comprehensive high-ticket treatment plan while the patient is lying flat on their back in the dental chair with a bib and this suction and a bib around their neck. They feel vulnerable and defensive. Sit them up eye to eye, or better yet, move them to a neutral consultation room. Then show visual evidence. People remember 90% of what they see. Patients do not understand our jargon, but they understand a photograph. I can say, well, we then screw a titanium abutment on your implants. What? They don't understand that. You show them a picture, understood. People remember 90% of what they see and only 10% of what they hear. And nearly nothing of what you say, although they hear it. Use your intraoral camera, show them the correct amalgam. When they see the problem on a large screen with their own eyes, the problem becomes theirs, not just a concept you're trying to sell. The power of menu options. Eliminate the yes or no ultimatum. So no ultimatum. One of the fastest way to increase case acceptance is to stop giving ultimatums. Just like, well, this is what we can do. Yes or no? No. Always offer menu options, typical 3 different options, okay? When you present a good, a better, and a best scenario, you shift the patient's internal dialogue. So they stop asking themselves, should I do this? And they start asking themselves, which one of this should I do? So it's now not yes or no, it's yes, and it's which one? It's basic psychology. So what mistakes during the case presentation can we do? Okay. Do not overwhelm with clinical technicalities. Our passion for dentistry often works against us. A major mistake is overwhelming the patient with the technical steps. Oh, we would do this, and then we do that, and we do that, and here and there. Okay. Of placing a bone graft, or the chemistry of lithium desilicate crowns, and lithium desilicate is better than feldspathic in this case and that case, and feldspathic is better than lithium desilicate in this and this. No. Enthusiasm sells. Yes, it's very important. But technical overload creates confusion. And a confused mind always says no. So the 3 step techniques for patients to say yes: future vision, the feeling, the consequence. So there is a very specific 3-step psychological framework for getting a yes. First, establish a future vision. What will you do when your smile is fixed? Okay, so they own the treatment. So, oh yeah, I will feel so much better. And okay, so they tell you positive information. Then, second, lock in the feeling. How confident will you feel at the wedding? Yeah. And then the third is construct it with the consequence. So what happens to your bite if we let this deteriorate? So if we don't do anything. So boom, you destroy this picture, and now he feels his pain more than ever. The contrast makes the decision obvious. So I have to do it. Okay. The nature of resistance. Objections are opportunities, not rejections. Inevitably, you will face objections. The key to high performance is understanding that an objection is not a personal rejection of your clinical skills. It is simply resistance. It is the patient asking for more information or reassurance. Do not get defensive. Embrace the objection as an opportunity to build more trust. So if an objection comes, perfect. You can build more trust for the future. So how do you handle these objections? Well, the 3F methods. The step 1 is to say, well, I know how you feel. The ultimate framework for handling resistance is the 3F method. The first step is feel. When a patient objects, immediately validate them by saying, I know exactly how you feel. This immediately diffuses tension. So the patient that makes resistance, that is tension, okay? Hey, here. And immediately, so if you say, yeah, true. You're now sitting on their side of the table rather than fighting with them. Just with a simple sentence. I know exactly how you feel. Then the second step is, others have felt that way too. You follow up with, many of our patients have felt that exact same way before starting the treatment. What does that say? This is pure social proof. It normalizes their anxiety or financial concern. They realize they are not alone or foolish for hesitating. It's normal that they hesitate. Okay? So this lowers even more the tension. And then you say, but what they found was found. The third F is found. You conclude, but what they found was that investing in these implants completely changed their quality of the life. And their only regret was not doing it sooner. You can change implants by veneers or by whitening or by endodontic treatment or whatever, okay? So feel, felt, found. You smoothly redirect the resistance into a highly positive closing narrative. The too expensive objection. Isolate the objection. The most common objection worldwide is it's too expensive. When you hear this, you must isolate the objection to see if this is true. You ask, is price your only concern? If they say yes, the only concern, then you introduce third-party financing, for example, okay? So they can pay it in installments and so on. If they say no, then the money isn't the real issue. You haven't built enough value or trust yet. So you have to continue to build more value and more trust. Answering a question with a question. Hook the mind, maintain the control. If a patient asks aggressively, why is this so expensive here? Never answer with a defensive breakdown of your lab bills or overhead or something like that. Answer a question with a question. Why do you think hundreds of patients have chosen to invest this amount in their smile with us? Let them talk themselves into your value. The indecisive patient. What most people do technique. We all have patients who freeze when asked to make a decision. To handle the highly indecisive patient, use the what most people do technique. So you say, Mr. Smith. So you see the patient is indecisive. Yes, he wants, no, I don't know. Okay, Mr. Smith, what most people would do in your exact situation is start with the upward arch. It removes the pressure. They don't have to decide. Humans naturally want to follow the herd. Does it work always? No, but most of the times. Asserting clinical authority. My experience tells me if social proof doesn't work, so if the indecisive patient says, no, I'm still indecisive, no, I'm not most of the people, okay? I'm a special people. I'm a special person, not like most of the people. Okay, don't worry. Then you use the clinical authority. How does that work? Well, if social proof doesn't work on an indecisive patient, you must leverage your authority as a doctor. So you look them in the eye and say, my experience tells me that this is the safest and most predictable option for your long-term health. When they are lost, they want you to lead. Let's go to the closing sequence. Value in advance. Sell the chocolate by giving a taste. As we move into the close, remember that the easiest way to close a case is providing value in advance. How do you do that? Give them a taste. Use a digital smile design or a physical intraoral mock-up. Once the patient physically sees and feels themselves with a beautiful new smile, they are sold before you even say a word. Or you can show them pictures of before and after of exactly this case like they have. Preconditions for a good close. Absolute clinical conviction. Before you ask for a single euro, there is a strict precondition for closing. You must possess a deep, unshakable belief in your own clinical skills and the treatment plan. If you're not absolutely convinced this is the best medical choice for the patient, they will sense your hesitation and reject the case. And if you're not good, then take a course. For example, from the Mastery Academy. The closing sequence, information and solution. So summarize the pain, present a specific cure. The formal closing sequence requires structure. First, you gather the information by asking questions to uncover the pain points. Then you present a solution by tying your specific clinical treatment directly to their emotional pain. Do not fire all your value at once. Save some features for later if they resist. Then you come up with new so that you can build up more trust and more value. Okay? Avoid inducing doubt. Now, never ask, do you have any questions? No. He says, oh, I should have questions? Wait, well. Then he starts doubting. Right before you ask for the commitment, never ask, do you have any questions? This phrase instantly makes the patient think they missed something or should be doubtful. Instead, assume control and ask, what questions do you have for me? If they say no, none, proceed straight to the close. It's a very small change of your question, but this very small change is psychologically very important. The assumptive close. There are many different closes. I will talk now about one or two of them, okay? The assumptive close. Expect them to say yes. You must adopt the assumptive mindset. Expect patients to say yes. Then it is a self-fulfilling prophecy. Do not approach a presentation hoping they might accept. Approach it with the absolute certainty that you are simply helping them figure out the logistics for scheduling the treatment they already want. The final question, be clear, be direct. When it is time to close, be direct. Do not use weak language. Ask a clear, committing questions. So, for example, are you ready to move forward and get your smile back? Or would you prefer to schedule this for Tuesday or Thursday? That is, by the way, the alternative close. Okay, you give the patient an alternative, Tuesday or Thursday, but so they think about Tuesday or Thursday. They don't think about, should I do it or not? And the golden rule of closing, ask for the close and then shut up. Here is the golden rule for sales, and it applies perfectly to your case acceptance. After you ask the closing question, you must shut up, be silent. The silence will feel incredibly uncomfortable. Like now. But he who speaks first loses. The tension forces the patient to internalize the decision. Embrace the silence. And passing the baton, the seamless handoff to the treatment coordinator. Once they say yes, the handoff must be seamless. If you use a treatment coordinator, pass the baton with the authority. Mr. Smith, our coordinator, Sarah, is going to take excellent care of you and organize the logistics. This ensures the high-level Ritz-Carlton experience continues all the way to the payment terminal. Closing is a service. Closing is something you do for somebody. I want to leave you with a profound shift in mindset. Closing is not something that you do with somebody or to somebody. Closing is something that you do for somebody. By successfully closing the treatment, you are giving them the gift of health, function, and confidence. You do it for him, not you do it to him. So the transition to delivery. Trust is secured. Performance begins. Communication secures the trust. The case is accepted. The financial logistics are settled. Now, it is time for us to deliver the high-performance clinical dentistry that we promised. In the next section, we will discuss how to maintain this trust during the actual procedure and turn them into lifelong referrers. Good. Delivering the promise. Sales is a promise. Delivery is the proof. The patient has said yes. The case is closed. But understand this, sales is simply a promise. The clinical delivery and the operational efficiency of your office are the proof. If your scheduling is chaotic or you attract the wrong type of patients, the high-end Ritz-Carlton experience collapses. There are 4 types of patients to run. Not all the patients are created equal. To run a high-performance practice, you must audit your patient base. Not all the patients are created equal. We can categorize every patient in your database into one of four strict types, A, B, C, and D. Knowing who sits in your chair dictates your stress level and your profitability. So the A patient, the raving fan, they are your ambassadors. Your raving fans accept your treatment plans without haggling. They pay on time. They show up on time. Most importantly, they actively refer their friends and family to you. Your entire marketing and communication strategy must be engineered to attract and duplicate the A patient. B and C patients, average and complainer. B patient is average. They are good people. They accept basic treatments, but they don't actively refer. C patient is a complainer. They are often late, they question your fees, and they drain the team's energy. You must train your staff to elevate the C patients with outstanding service, or if they don't elevate to B or A, bye-bye. Let them go. How do you let them go? You raise the fees, or you only give them the very expensive choices. They leave by themselves. The D patient, the toxic drain. Fire your toxic patients. The D patient is toxic. They are constantly no-shows. They demand refunds. They are rude to your front desk, and they threaten your medical license. A high-performance practice does not tolerate D patients. You must have the courage to professionally dismiss them from your practice. Thank you so much. Your trust is not on me, and my trust is not on you. They cost you more in mental health than they pay in fees. Operational efficiency, scheduling. You control the scheduling does not control you. To attract A patients, you must run an efficient clinic. Efficiency comes down to mastering the schedule. If you are constantly running 30 minutes late, you violate the trust of premium patients. You must take absolute control of your appointment book. How? By block scheduling. Abandon the chaotic first come, first served scheduling method. Implement block scheduling. Pre-block, block out, maybe your mornings or 2 hours in the morning, 2 hours in the afternoon, they are blocked, and only A patients and only big cases and an implant or a large aesthetic rehabilitation will be scheduled there. If they're not scheduled 3 days before the date, then if they're not filled, then they can be scheduled with smaller things, okay? Leave the afternoons for shorter, low production procedures and checks. The engine of your practice is the hygiene schedule. The hygiene schedule is the economic agent of your practice. It must run flawlessly. Do not let the doctor become the bottleneck. The hygienist must learn to pre-frame any clinical issue. Tell the patient about it, okay? They see. So when you walk in for the exam, the patient is already expecting the diagnosis. Idea number 1, put packages together. Bundling, so bundle, increases perceived value. Let us look at the low-cost internal marketing to boost these schedules. Idea from my marketing protocols. Put packages together. Instead of charging separately for an exam, a panoramic X-ray, and a cleaning, bundle them to a new patient welcome package at a specific price point. Bundling drastically increases perceived value. You show them how much it would be separately and then how much it is. Okay? The fishbowl collection, idea number 2. Build your database organically. You need a massive database to market to. Use a fishbowl collection method. Place a nice glass bowl in the front desk. Offer a monthly drawing for an elective toothbrush or whitening kit in exchange for dropping their business card or their data. You instantly gather names, emails, and corporate connections for 0 marketing costs. Video marketing. To stay top of mind, you must use video marketing. It does not require a Hollywood production crew. Your smartphone is enough. Record a simple 60-second video explaining a common procedure or answering a frequent patient question. Authenticity builds trust far faster than highly polished corporate ads. And strategic giveaways. Keep your brand in their bathroom. When a patient finishes a premium treatment, do not let them leave empty-handed. Give them a branded, high quality item like a premium lip balm or a branded whitening toothpaste. You want your clinic logo sitting on their bathroom counter every single morning. You have no money for this? Put a sticker of your logo on a premium toothpaste. Personal branding and leadership. The dentist is a brand. You are the product. In the elective medical space, patients do not just buy the clinic, they buy the doctor. You are the product. Your reputation, your communication style, and your clinical philosophy make up your brand. You must actively manage this brand in your community. How? By defining your mission and your vision. Where are you going versus why are you going there? A strong brand requires clarity. You must define your mission and your vision. They are not the same. Your vision is where you want your clinic or you to be in 10 years. And your mission is why you are doing it today. It is your daily commitment to the standard of care and provide every patient. So defining your mission, the daily standard of care. Your mission must be actionable. It cannot be corporate jargon. A true mission is something your assistant and your front desk can act on every single day. For example, our mission is to provide painless, predictable dentistry in an environment of total respect. That's a mission. And a vision would be the compass for your leadership. If your vision is to become the premier aesthetic implant center in your city, every financial decision, every hire, every piece of technology you purchase must align with that ultimate destination. Personal branding secrets. Consistency builds equity. The secret to personal branding is radical consistency. From the clinical photos you post online to the way you dress in the clinic and the tone of voice your front desk uses, it must all align. Inconsistencies confuse the market and dilute your premium positioning. Elevator pitch. Who you are in 30 seconds. As the face of the brand, you must master the elevator pitch. If you meet someone in a dinner party and they ask what you do, saying I'm a dentist is a missed opportunity. You need a 30-second script that clearly articulates your unique value proposition. Structuring your pitch. Target, problem, solution, result. Structure your pitch with precision. Identify your target. State the problem. Introduce your solution and paint a result. Here is an example, okay? I help professionals, target, who are embarrassed, problem, by their teeth, achieve a predictable high-definition smile using advanced digital design, your solution, so they can smile with total confidence and raise the self-esteem, self-confidence and esteem. So paint the result. Delivering the pitch. Confidence and eye contact. A great pitch requires great delivery. When you speak, it maintains strong eye contact, speak slowly, and with absolute clinical authority. This is how you generate high-value referrals outside the four walls of your practice. And you have to ask for referrals. Strike when the emotion is highest. Do not be afraid to ask for referrals. The absolute best time to ask for a referral is the moment you hand them the mirror at the end of a big case, when their emotional response, when they smile, okay, when their emotional response is at its peak. Look at them and say, we love having patients like you. If you have friends or families who need care, we would be honored to see them. And then you give them 3 business cards. They should give them to friends and family. The team as your engine. You cannot build a premium practice alone. We have discussed your personal brand. and your closing skills. But you cannot deliver Ritz-Carlton experience alone. Your team is your engine. If your clinical skills are at level 10, but your front desk and assistants communicate at level 3, the patient's perceived value of your practice drops to 3. Identify growth KPIs, key performance indicators. To scale a modern practice like a true CEO, you must track your growth KPIs. That what you don't measure, you can manage. Gross production is a vanity metric. It is just a symptom. You know where your sales funnel is actually leaking. You must track 3 specific actionable KPIs every single month. Here's the thing. Phone call versus appointment. First metric is patient conversion. So if they call, okay, how many people called for the information and how many actually schedule an appointment? So from 100, so if marketing generates 50 calls, but only 10 schedule, your front desk is failing at handling the shopper. They need immediate phone training. Okay, so from 50, only 10 make an appointment, something is happening at the front desk. Okay, then show up. So they make an appointment, but they don't show up. So the second metric is your show up rate. If patients are constantly canceling or not showing up, you do not have a patient problem. You have a value problem. It means your front desk did not establish enough medical urgency or value when the appointment was made. Then the third metric is the case acceptance rate. Are you diagnosing or are you converting? The third critical metric is case acceptance. If you present 100,000 euros in treatment this month and the patients only accepted 30,000 euros, your acceptance rate is 30%. That means your clinical diagnosis is fine, but your communication and closing skills are failing. This is where you must train. So the 4 skills of modern dentist. 4 pillars of success: clinical, management, marketing, sales. To tie this entire masterclass together, we must look at the 4 most important skills in dentistry today. If you want to survive and thrive in a hostile, competitive market, you must master all 4. Being a great clinician is not long enough. It is merely the baseline. It's important, but baseline. Skill number 1, clinical excellence. Skill number 1 is clinical excellence. This is the foundation. You must have the hands, the knowledge, and the technology to deliver painless, predictable, high-definition dentistry. Without this, no amount of marketing or sales will save your practice. Skill number 2, business management. This is the ability to lead a team, to control your overhead, establish block scheduling, front desk scripts. So what to say when somebody asks for a price, what to say if somebody, that are scripts. And create the Ritz-Carlton environment. Management is what ensures the clinic runs efficiently even if you are not looking. Skill number 3, marketing. Whether it is the fishbowl technique, video marketing, strategic giveaways, marketing is your ability to generate awareness. It is how you make sure the community knows your personal brand and your clinical philosophy. And then sales and communication. This is the bridge. It is your ability to sit knee to knee with a patient, use active listening, ask the right questions, and smoothly guide them through the fears and objections until they say yes. Yes to the treatment they desperately need, not want, need. Why dentists fear sales? You have to make a shift of paradigm. Many dentists are uncomfortable with the word sales. They feel it is unethical. You must shift that. Selling a patient a car they don't need is unethical. But persuading a patient to treat a severe infection or restore the confidence to smile, that is the highest form of medical ethics. It is ethical. So let's resume everything now, okay? Pillar number one, the patient experience. Let us review our action items. First, audit your patient experience. Remember that patient satisfaction is a perception. Transform your waiting room into a lobby. Train your team on the 82% rule of the telephone tonality. Make sure you are on stage the moment the patient arrives. Pillar number two, active listening, 80-20 rule, okay? Implement the 80-20 rule of communication immediately. Stop lecturing your patients about features. Ask powerful questions, let them speak 80% of the time, and restate their concerns. I mean, you just repeat what they are saying, okay? He who asks the question controls the conversation. Pillar number three, menu options and persuasions. Third, utilize persuasions. Gift wrap your clinical value by presenting it in a premium way. Always offer 3 treatment options to eliminate the yes or no ultimatum and help the patients pre-own the result by asking them to envision. They should see themselves already having that treatment done. Pillar number 4, mastering objections. Embrace objections. Feel, felt, found. Stop defending your fees. Use the feel, felt, found method to show empathy and provide social proof. And if you face a highly indecisive patient, use the what most people do framework to safely guide their decision. Then, pillar number 5, the assumptive close. Remove the words cost and pay and replace them by investment. Ask for the commitment clearly and then shut up. Embrace the silence. And remember, closing is not something you do to a patient, it is a medical service you do for them. And now, pillar number 6, protecting the A patients. Categorize your database, bend over backwards, make everything that they want for your A patients. Use strategic giveaways to keep your brand in their homes. And do not be afraid to professionally dismiss the toxic D patients who drain your team. And track your funnel. Measure your conversions. Stop looking only at production. Look at your new patient conversion rate and your case acceptance rate. Identify exactly where your sales funnel is leaking so you can train your team effectively during your morning huddle. And you are the brand. You are the face of this operation. Your personal brand is built on radical consistency. Define your daily missions, your ultimate vision, and ensure every single touch point in your clinic reflects the premium medical standard you stand for. And my final thought, high performance is a daily discipline. Success in high competitive dental market is not an accident. It is the result of applying the same rigorous scientific discipline we use in implantology to our business systems and our patient communication. Amateurs compete. Professionals build trust. And thank you so much for your time. So I close now my presentation and I hand over to Denflix.
Thank you. Thank you, Dr. Gomez. Thank you for your wonderful and insightful session. A lot of thanks from us and from all the attendees. Now we are moving to a Q&A section. If anyone has any question, please send it in the chat box, and I will read it aloud for Dr. Gomez. Many thanks. Or all of our attendees is thanking you, Dr. Gomez.
Thank you. Thank you so much.
Any questions? Okay.
I think everything was clear.
Yeah, yeah, yeah. It was clear. So, someone is asking, how can dental student do a personal brand?
Very easy. As a dental student, you also need patients, okay? And these patients can call the university so that you get them to be treated by you. And the dental student can start a YouTube channel, can start Instagram channel, okay, about dental issues. So you start talking about dentistry from the very beginning that you are, and then you build trust in your environment, in your community, okay, but by giving dental advice to patients.
Nice. Dr. Hindi is asking, is it possible to leak the funnel in the front desk after I already lost patients, or the reputation already falls down and no way back?
For me, it's not clear who made the fault. I have understood the question like this: the dentist screwed up, and the patient and lost the patient, and now wants the front desk to take the patient back. This is possible. The problem is you must again feel well found. Okay, you must build trust again to for that patient. Okay, and of course, honestly, asking for forgiveness.
Yeah, Dr. Hand asked that the front desk is the issue.
The front desk is the issue. No, you have to train your front desk.
Okay. Dr. Ala asked how to sell confidently a new line of treatment, like MyoPress.
How to train?
No, to sell a new line of treatment like MyoPress in
Oh,
a confident way.
you make small videos about that issue. That means, and you send them per WhatsApp to your patient base. Okay, the patient base. Every clinic has a patient base, and per WhatsApp you make a very small video, 30 seconds, 60 seconds, introducing this new line that you are offering now in this clinic, and this proves you are constantly improving, and you're constantly looking for new technology and new ways to serve the community and to serve your patients. Okay, and some people of that would say, oh, that's a good thing for me. Okay, of course you show in these videos, you have to show what problem is solved. You don't have to show how it is done and how it is and the features of it. What's the problem and what does it solve and what is the result?
Okay. Dr. Haider asked, is there any observations regarding the patient anesthesia? He is or she is an anesthesiologist.
Patient anesthesia.
Yeah.
Well, that's a feature that you can have. You can have nitrous oxide sedation, and the patient then is in a calm environment. You can have that as a trust builder. Okay, people fear the dentist. That's not a new thing. They
Yeah.
fear the dentist ever since. Okay, and we know that. And of course, if you have ways to reduce that anxiety by new ways of anesthesia, like the wand, for example, okay, or this ultrasonic needle that you don't feel, or you have a special way of delivering the anesthesia. Notice I did not say inject. Always use words that do not imply needles or something like that. Okay. So You have to communicate always in a positive manner so that the patient lowers the anxiety and thinks this is the person. So the new ways of getting numbness, not painlessly. Pain immediately, always, if you use the word pain, bad news. Okay. So you avoid bad words, but saying that you do anesthesia in a good way. Okay. But without saying that you inject anesthesia.
Okay. I think there is no other questions. Okay. Last question by Dr. Hand is asking. Another question is how should I manage the walk-in patients when I am not in the clinic, but I can arrive to check them, especially that I am in the startup.
Okay. The walking patient that wants, yeah, here is the thing. Okay. Do you want them to think that you are desperate looking for patients? That means you're not so good doctor for them, you know? So walk-in patients is a good thing. And although your schedule is completely empty, if you are not there in this moment, you don't come. Your front desk says, our doctor is so busy. Um, she looks towards the treatment area where nobody is in that moment because you're out, but as if there was somebody there working. Okay, so busy. Let me check. When would be a good time for you? And maybe I can squeeze you in. Okay, but not immediately. Immediately shows how desperate you are to get the new patient. You're not desperate. You are an asset. You are precious. You are a very, very important doctor, although you're not in that moment. But you have to behave as if you are from the very beginning. Then you will become one. Is that clear?
Yeah. Thank you. This is the last question by Dr. Najwan. I think if you can read the question, doctor, as it's a long question. She is an orthodontist.
Mhm.
Most of the time, she is seeing ineligible cases for orthodontic treatments, mostly for periodontal or gum disease. So in that cases, we face a problem in case acceptance, even though the patient trusts our treatment. Honest, the orthodontist for sure will refer them immediately to other doctor for urgent treatment. So, what's your advice in such cases when your conversion is not good due to some cases issues?
Okay. As I understood the question,
Okay,
patients come in, they trust the orthodontist in the treatment plan, but they have issues that have to be referred before we start with the orthodontic treatment. Okay. And that is where she loses the patient, so that they don't do the orthodontic treatment immediately. So
right,
here's the thing, we could commit, that means a prepayment, small installment for the orthodontic treatment right away, so that we will do the orthodontic treatment, don't worry. But please understand, dear patient, understand that we need to have a healthy environment so that the result in orthodontics is ideal. Okay, so for this healthy environment, I will send you to a specialist. So he will make this the healthy environment, and you come back to start the prepaid already treatment. Okay, here with us. Not completely prepaid, but an installment. Okay, so it's a commitment. I commit myself to help you. You commit yourself to make the orthodontic treatment. That's the only way.
Okay. That was the last question, doctor.
Okay.
Thank you very